Hi, y'all. Welcome to our Diet and IBD Facebook live chat. My name is Megan Kaler, and I'm the Foundation's Take Step Marketing Manager. And I'm so excited to host tonight's live chat. This is my first one, so I'm very excited to be here. Patients living with Crohn's or colitis may experience nutritional deficiencies and may have dietary problems like food intolerances and more. Because of the individualized nature of IBD, there's no one IBD diet. What works for one patient might not work for another. However, there are many ways that patients can use diet and nutrition to assist with symptom management. So I'm a patient as well. I'm a Crohn's patient. I have followed the paleo diet as well as others, but I've very much come to learn that, one diet does not fit for everybody. What works for me does not necessarily work for, my cousin or whoever. So I'm so excited to be joined today by Emily Holler, a registered dietitian with the Taubman GI Clinic at Michigan Medicine. In her role, Emily provides diet and nutrition advice along with resources necessary for patients with gastrointestinal conditions to implement and sustain a balanced diet. Emily, thank you for joining us today.
Hi, thank you. I'm so excited. This is also my first live, so looking forward to having a really good chat today with everyone.
Yeah. So for the next 30 minutes or so, Emily and I are going to answer your questions about the role diet can play in IBD. We want this to be interactive though, so please feel free to leave questions under the video and tell us who you are, where you're from, and any questions you might have. A few important disclaimers before we get started. The information provided during today's chat is meant for educational purposes only. IBD is experienced differently by every patient. There is no one diet that works for all IBD patients. We encourage patients to work with their GI and a dietitian to figure out what foods do or do not work for them. The views shared during today's chat do not represent official position of the Foundation, and always consult with a physician before making changes to your IBD treatment regimen. And as usual, tonight's topic is diet and nutrition. If you have questions about other topics related to IBD, we won't have time to get to them tonight, but we do encourage you to contact the IBD Help Center with your questions at info@Crohn'sColitisFoundation.org or 888-MY-GUT-PAIN. All right, with all that out of the way, we're going to jump right in and get started. So we're going to start out with the basics. Can you explain the difference between diet and nutrition?
Yeah, that's a really good place to start and a really good question. So diet can be defined or thought of as the foods and beverages that we consume. And another way to think about diet or define it is it can be a type or a kind of food that's prescribed in a certain amount for a special reason or for a person. So we can use diet as specific therapies for people. And then nutrition can be thought of or defined as the act of being nourished or nourishing. So sometimes it can be thought of as like properly digesting our food or our diet, can refer to kind of being healthy. I like to think about it in terms of our diet provides us with our nutrition, right? So it's providing us with our macronutrients, our carbohydrates, our proteins, our fats, and then our diet's also providing us nourishing micronutrients, meaning vitamins and minerals and phytochemicals or antioxidants that are coming from plant foods, as well as fiber. And for me, when I'm thinking about diet for my people who have IBD, we're looking for a diet that is nutrient dense, right? So providing all the nutrition, and for a diet that someone likes eating, that they enjoy eating, and then also a diet that doesn't exacerbate symptoms. And I think when we can hit all three of those, boxes or goals, that not only benefits health, but it can benefit quality of life. So those are things that I think about when I think about diet.
Okay, that's awesome. So why does having IBD put you at risk for having nutritional deficiencies or dietary issues?
Yeah, also really good question. I have a feeling all of these are going to be really good questions. So people with IBD are at risk for nutritional deficiencies for several reasons. Starting with one, just decreased oral intake, right? Not eating enough food. And that might be because of symptoms. So things like abdominal pain, bloating, cramping, diarrhea are good motivators to maybe not eat enough, especially if someone is linking their symptoms to meal times. So that can predispose somebody for nutrient deficiencies, not eating enough. due to symptoms, to a poor appetite, maybe a restrictive diet or overly restrictive diet, which can happen for several reasons why someone might be restricting what they're eating, but that can lead to nutrient deficiencies. Inflammation of the GI tract can cause malabsorption of various nutrients, and that can lead to nutrient deficiencies. And then third, medications. So we know that certain medications can also interfere with micronutrient absorption. That might be an issue. And then, oh, hi, Alyssa. And then also enteric losses. So if someone has chronic diarrhea or fistula, that can be another reason why or how we might see people develop nutrient deficiencies. Did that answer your question?
Yeah, no, I think you covered it all. That was a great answer. So moving kind of in the same direction, what are common nutritional deficiencies IBD patients may experience and how are they treated?
Yeah. So first and foremost jumps to mind is vitamin D deficiency. Very common. And for me, it's really common in my clinic. And I think it's just because we're in the Midwest, we're in Michigan, we have winter for 5, months of the year. But also, I mean, even if you live in a really sunny area and if you're wearing sunscreen, which I hope you are, because it's very good for skin health, that is going to prevent you from getting vitamin D from the sun. And there's really not good vitamin D sources enough in our diet to keep our levels adequate. So that's a common deficiency. And when we see that, whether it's insufficiency or deficiency, we typically recommend a high dose vitamin D, a weekly vitamin D2 ergocalciferol, 50,000 units. Someone will take that 1 or 2 times a week. And then after that, generally a maintenance dose of vitamin D3, cholecalciferol, is prescribed. And that maintenance dose is going to look different for different people. It kind of depends. So typically 1,000 to 2,000 international units, but that's something that you should definitely discuss with your provider always. But yeah, so that's a common one. Anemia is another common deficiency that we see. And anemia can be from iron deficiency anemia. It can be from a folate deficiency as well as a B12. However, iron deficiency anemia is the most common that we see in people who have IBD. So if that's the case, either IV or oral iron supplementation is going to be provided. And that kind of depends, again, on the person and their clinical status and situation, which is appropriate. And then if someone has a B12 deficiency, typically if they're deficient, we need to do an IV repletion. There's also oral vitamin B12 supplements. And then folate, 1 milligram daily for 2 to 3 weeks is typically pretty sufficient for repletion of that. And then if we have any bone health issues, history of osteopenia, osteoporosis, we're thinking calcium supplementation. I know I mentioned earlier that certain medications can interfere with micronutrient absorption. So 2 in particular, sulfasalazine and methotrexate are folate antagonists, or they inhibit absorption. So my people who are on those medications, and we're recommending 1 milligram of folic acid during treatment. For that, cholestyramine can impair absorption of fat-soluble vitamins, and steroids can also inhibit calcium again and phosphorus. So we're thinking bone health, and if someone needs to be on supplementation for that.
So I have a question that bounce off of that. How do you know if you're deficient nutritionally? Like, what would be the next step?
Mm-hmm. So the best way to know if you have a deficiency is have your lab levels checked. Yes, there's physical signs and symptoms, but there's so much overlap of deficiencies and signs and symptoms. So we want to check labs, and that's a really easy thing to get done. And we have cutoff levels, so we know if something's high or within normal limits and low. And so if something's low, and that's how we'll know if you have a deficiency.
Perfect. Okay, I'm learning something new. So when it comes to eating and choosing what foods to eat, what foods should patients eat when they're flaring, or what should they avoid when they have a flare?
Okay. Yeah. So this is, again, a really good question, and something I spend a lot of time in clinic talking about with my patients. So, kind of strategies for eating when we're in a flare versus when we're in remission. So thinking about when we're in a flare, this, of course, is going to be a little bit different for everybody, right?
Mm-hmm.
But generally what we find is smaller, more frequent meals are better tolerated than large portion sizes. And that also is helpful for meeting nutrient needs, right? So if we're eating several small times a day, we have a better chance of getting enough calories and enough protein, which we have elevated energy needs and protein needs during a flare. So that's key. Generally lower fiber, but this doesn't mean fiber free. And I think sometimes that's a misconception. Everyone's fiber tolerance is different. So I always tell my patients, my people, like, you know your body best, but let's try to find ways to get in some fruits and some vegetables. And typically, from what I find is reducing insoluble fiber. So the thick skins and peels of fruits and vegetables can be helpful. So if you think about like a banana, you eat the inside, right? We're not eating the peel. Cantaloupe, honeydew melon, papaya, even kiwi, something like those fruits that you're not having the skin are generally better tolerated than, say, an apple or a pear with the skin on it. Again, I'm not saying that maybe you can't eat an apple, but that's not the place that we start. And then for veggies, same kind of cooked tender vegetables, utilizing a lot of soups or smoothies or stews or casseroles are good ways to cook those nutrient-dense foods. Having high-quality sources of protein, so whether you're doing like lean chicken or eggs or cottage cheese, and we may need to do a lactose-free trial too, because especially if somebody who has inflammation in their small intestine has Crohn's disease, they may become temporarily lactose intolerant. So switching over to a lactose-free milk, lactose-free cottage cheese, a lower lactose yogurt like Greek yogurt or lactose-free yogurt, or plant products. So something like almond milk or soy milk or pea protein milk. There's oat milk. There's a milk for everyone. So you find what you like. I mean, that's a good way to get in some calcium and vitamin D, and some of those will have protein in them. Creamy peanut butter, almond butter, tofu, also other sources of protein, and some high quality foods. So I would say smaller, more frequent meals, lower fiber, trial of lower lactose, and then avoiding things that are really high in fat, greasy, and spicy, because those are generally irritants too. So that would also be a part of a good strategy or place to start.
Okay. And we had a great question in the chat saying, how do you define a flare?
How do you find those questions?
They're on the right.
Okay. I see team chat, but I don't see the actual. Okay. I just wanted to look. So that's a very good question. So a flare is going to be an actual flare of like IBD, of Crohn's or colitis, means active inflammation in the GI tract. And what we know is that symptoms are not always correlated with what's going on in the gut. Actually, they can be a pretty poor predictor. So sometimes we can have symptoms and there's not active inflammation. It doesn't mean that your medications are not working. It could, but that absolutely requires follow-up with your GI provider, and they can do several tests. They can check several markers of inflammation like a CRP, and that's a level, it's a blood draw, and that can show inflammation in the body, but it's not specific to the GI tract. So there are other tests like a fecal calprotectin, which is a stool study that's more specific to the gut, and then endoscopies to look at what's going on inside of the GI tract. And that discussion should really be had with your provider. So yes, symptoms can be indicative of a flare happening, but also we can have symptoms because of food intolerances. And just because we have abdominal pain or bloating or cramping, especially with so for example, the FODMAP diet, we use a FODMAP diet a lot for people who have some functional GI symptoms that are associated with food. And that can be a really effective way to improve symptoms. And in that case, we don't have to have an escalation of therapy, right? We didn't need a different medication. We didn't lose response to our medication. It's just that we're, reacting to some of the foods that we're eating.
Awesome. That's a great explanation.
Ask more on that if that wasn't clear.
All right, so we're going to jump to a question we got in our email before the chat. It says, I keep reading about all these new diets, like the specific carbohydrate diet, gluten-free diet, but they weren't suggested or recommended by my doctor. Is there harm in trying one? And I just want to add, this is a great question and couldn't be any more relevant. Researchers are in the process of conducting the first ever national study of two diets, the SCD diet and the Mediterranean style diet, and their ability to induce remission in Crohn's. And we just finished recruitment and hope to have some results soon. But it was a great, timely question.
I cannot wait for the results of this study. I'm so geeked. is there harm in trying these? The answer in short is potentially, right? So it might be just fine, and it also might not be. And I would say that depends on how you conduct said diet. So if it's gluten-free or specific carbohydrate or low FODMAP, or I mean, there are other diets. Are you able to get enough calories and protein and vitamin and minerals with whatever diet pathway you're trying? And I would just be in good communication with your GI doctor. What diet do you want to try and why? And ideally a GI dietitian, because then that person can help set you up for success as far as giving you tips and tricks and ideas and other resources, right? I mean, there's really great websites out there for a lot of different diets and books and support groups. But then sometimes you can come across bad information, and then that can lead us down a path of it being harmful. So that's how I would answer that question.
Perfect.
Can be done healthfully, but also could be harmful if it's not done right.
So next question is, what's the difference between enteral nutrition and paraneutral nutrition, and why would
Parenteral nutrition.
Thank you. And why would these be used with IBD patients?
Okay, yeah. So enteral nutrition generally refers to any method feeding the GI tract. So that's what enteral means. It could be food, it could be formula. For the purpose of this discussion, I think we're thinking about nutrition support here. So for enteral feedings with a formula, that would be like a tube feeding or just drinking formula only instead of food. Could be a method of enteral. And when the gut works, we want to use it. We always want to try to feed the GI tract, overdoing parenteral nutrition, which is a form of nutrition that's given through the veins. It's intravenous, but that's also a life-saving therapy for people who cannot tolerate food or formula to their GI tract. And so with a tube feeding, there's, whether we drink a formula, it could just something like, a complete formula being consumed, meaning all calorie and protein needs, so no solid foods. And exclusive enteral nutrition is an example that's used in the Crohn's disease population to induce and maintain remission, especially for pediatric patients. Not so common in adults, but it is being done somewhere and some places with some success. And so that is one form, and that formula can just be taken orally. Also with a tube, someone may have a tube put through their nose into their stomach or their small intestine, or maybe having a more permanent tube placed in the abdominal region, and that can also be placed into the stomach or the small intestine. So that's what enteral nutrition is. And then parenteral, again, is through the veins. And sometimes that would be used if someone has short gut syndrome and they can't take anything orally. They have a persistent small bowel obstruction. They've, again, failed tube feedings or oral eating and they're malnourished, then it's absolutely appropriate.
That's very interesting.
Yeah.
So to share another patient question, they said, my provider suggested I try probiotics. Is it better to eat foods with probiotics in them or take a supplement? And what are prebiotics versus probiotics?
Okay. So let's start with what they are first. So probiotics, by definition, are live microorganisms. When taken in sufficient amounts, are supposed to offer benefit to the host, and that would be us. And probiotics can be in food, right? So they can be in things like yogurt or kefir or kombucha, which is a fermented tea drink, kimchi, those are some food examples. And then probiotic supplements are, of course, supplements, pill form that you can take. Prebiotics are food for the probiotics. They're like fertilizer, and they're found in plant products. They are kind of like fiber. They're not digestible by us, but when they reach the large intestine, they're rapidly eaten, fermented, and promote beneficial effects to the microbiome. And those are in also a whole host of things. So they're found in garlic, onions, artichoke, asparagus, chicory, bananas, barley, oats, yams have some prebiotics. So they're two different things. And then there are some products now on the shelves called a symbiotic, and that's when you have a probiotic and a prebiotic in the same pill.
Interesting.
So generally speaking, I do not recommend people just take a probiotic, especially my people with IBD, right? And so it depends, again, always thinking about the person, like, who are you? What type of disease do you have? What are we trying to make better? Why should we take a probiotic? And there might be a good indication or reason to take one. And so there's not good data. There's really no evidence to support the routine like administration or recommendation of probiotics in Crohn's disease. In ulcerative colitis, it's a little bit different of a story. There are specific probiotics. We're always looking, if we look to the research, we're looking at the genus, the species, and the strain, or the genre of the probiotic and species in the strain. So a specific one, E. coli Nissl 1917, has been studied in UC and has shown some favorable effects. And there's the D. Simone formulation that has also been shown to be effective in ulcerative colitis and pouchitis. So those are the two. If someone came to me with UC and was, asking about certain things, those might be appropriate ones to try. And anyone can look up research on probiotics. If you go to US Probiotic Guide, you can filter, and they have IBD in there. You can click IBD and click filter, and it'll pull up the research, and it will show you the level of studies and exactly what product they use, what species, what strain, what dosage. And that's pretty neat. So that's something you could also bring to your provider and talk with them about. And so, yeah, I guess it would depend on the person. That question asking, not knowing anything about this person, I mean, maybe you would want to try a probiotic, but you might not also want to. I like to take a food first approach. I think if we can do that first, and those foods, because they do have some live active cultures, help with a specific GI symptom or something we're trying to do, because in those foods, we're also getting calories and protein and micronutrients. So it's kind of like a double win versus taking a product. And then just as a reminder, I mean, these products are not highly regulated, right? So what you're buying, I mean, hopefully it's what is in there, but you do run the risk. I mean, if you can buy something that's third-party verified, and this goes for vitamin and mineral supplements too, somebody like USP, US Pharmacopoeia, or NSF, or consumer labs that are testing like a multivitamin supplement and saying, hey, this is what's in here and nothing else, that's ultimately ideal.
I'm learning so much, but I'm also seeing a theme that it's really dependent on the person.
For sure. And I have some people, I wish I could see the comments or the questions. Maybe I'll try to look later and add on to them. But some people also will go on a probiotic and they say, yes, this really helps me. Like I feel significantly different. And then that's great. That's the goal. So typically in those situations, I would say finish your bottle and see if you keep taking it, right? We can try to take a probiotic holiday where we come off of it and see if it did its job, and do we routinely have to keep taking this every single day? That's another thing to keep in mind.
Awesome. So the next question is, what impact can surgery have on your diet and nutritional needs?
Yeah, so after surgery, our calorie and protein needs are higher. So that's the biggest thing that I would say is, sometimes we might not have as strong of an appetite after surgery, or depending what type of surgery you had and you're healing, we might, especially if it's an intestinal surgery, which in my clinic, a lot of times that's what it is. We do a lower fiber diet for about 4 to 6 weeks, easier to digest. Again, potentially lower lactose, will depend on the person, but definitely the goals are to get enough calories and enough protein to promote healing. If we're undernourished, or if we're malnourished going into surgery, that's not ideal. And so that's high priority.
Okay. Very interesting. I had never thought about that before, that you needed more after surgery, but it makes sense.
Yeah, your body's trying to repair itself. It's trying to heal. So that's key.
So what products are helpful for patients who struggle with dehydration? Are there any products?
Yeah, there are. So sometimes, especially if someone has a lot of inflammation going on, more water, or if someone has short gut syndrome, more water coming in can sometimes lead to more coming out. It doesn't necessarily rehydrate you or help, and we can become dehydrated from having a lot of high ostomy output or diarrhea. So what I would suggest is trying something, a sports drink is one place to start. And the reason why those are good is because they have some glucose and some sodium, and that helps with water, or that helps with fluid absorption in the GI tract. But even better than that, most of the time is an oral rehydration solution. So something like Pedialyte or Drop. I mean, there's other brands. You can make your own at home. There's a ton of really good recipes online. I've tried a lot of different ones, and they turn out pretty good. And that has like the optimal ratio of sodium to glucose to kind of act. There's transporters in our GI tract that helps us absorb fluid, and that can be very effective. And we recommend is sipping on that throughout the day, not chugging it all at once. Those would be, because that doesn't really help. That would be a good thing to try if someone's getting dehydrated.
Okay.
And also, actually, one other thing I would point out, thing I noticed with some of my patients will start drinking things like juice, right? Because they feel like that tastes better, they're tired of water, can be helpful. But sometimes juices, because of their high osmolality, oh gosh, can't talk. Yes, so that like apple juice can have a laxative effect. So that's something I would think too. If you're drinking a lot of juice or sodas with high fructose corn syrup, those things can also have sometimes a laxative effect. So sticking more towards water, towards sports drinks, even like, a Propel is going to be better than, to me, like a large amount of juice.
Right.
Having a lot of diarrhea.
Okay. Very interesting. I didn't even realize that, those help. I mean, I know they help with dehydration, but when you think about an IBD way, it's really helpful. So our last question is going to be, how can patients find a dietitian with experience helping IBD patients?
Yeah, so IFFGD has a dietitian searcher. It's the International Foundation of Gastrointestinal Disorders. They have a dietitian search function where you can find a special GI-focused dietitian in your state. Eatright.org has a dietitian finder. So you can go there and search and click a box that says gastrointestinal disorders. I should ask you, do you have anything on the Crohn's and Colitis Foundation? I feel like reaching out to local chapters can be very helpful. So like our Michigan chapter is great, and they're really good at connecting patients to local resources and finding a dietitian near them. Do you guys have
Yes, on our IBD Help Center, there is, information on how to find someone.
And there we go.
Perfect. So I want to thank you so much for joining us tonight for tonight's IBD and Diet Facebook Live. A big thanks to Emily for hopping on here and taking the time to chat with us today, and her comments to helping the IBD community navigate diet and nutrition. Like, we really, really appreciate, because I know with all of us being so different, we all have tons of questions. So we really appreciate it. Do you have anything you want to add for tonight?
I just want to thank you guys so much for all the people that have come to this live chat. This is awesome. Thank you to the Crohn's and Colitis Foundation for asking me to come here and providing such great resources to patients. You guys do such a stellar job.
Awesome. So I just want to share some final comments. Keeping a food journal can be a helpful step toward figuring out what foods work and don't work for you. As we've discussed a million times tonight, it's different for everybody. So keeping track is really important. Right now, if you request our free food journal, we'll send you a special Cure Crohn's and Colitis wristband. There are a limited number of wristbands available, so order now before there are none left. You can order your complimentary food journal by contacting the IBD Help Center at info@crohnscolitisfoundation.org or 888-694-8872. And make sure to tune in next month for a special Facebook Live chat about sex, intimacy, and IBD during Crohn's and Colitis Awareness Week, and we'll have more details about that soon. So thank you so much again, Emily, and I hope you all have a great night.
Yeah. One question for you, actually. So with comments, will I be able to see them like once this is posted on your guys' Facebook? Because I'd be happy to go back and like chat too.
Yeah, it's archived, so you can go back and watch it.
Yeah. Awesome.
All right. Thanks, y'all. Bye.
Bye.